speaker from Azerbaijan, Professor Rostamov from Azerbaijan, from Research and Development Center of Khazar University. The title of Professor Rostamov, his presentation title is Experiences of Azerbaijan in Facing Coronavirus Challenges. We wait for Professor Rostamov to get connected and then hopefully start his talk as soon as possible. It seems we have no connection yet. Oh, yes. Professor Rostamov, can you hear me?
Yes, I am fine with this communication.
Okay, thank you very much. We are eagerly waiting for you to start your presentation, please.
Thank you very much. At first, I would like to express my personal gratitude for invitation, making able to share some of experience taking place in Azerbaijan in this very hard time, not only for our agents, it covers world third. So it's an excellent opportunity to see all of you and get feedback from my colleagues, which definitely we will use in our further activities in Azerbaijan, making our life as best as possible. Please, next slide. Within the framework of my presentation, I would like to provide some brief information about myself and prevention actions which have been done by Azerbaijani government, how to limit negative consequences of COVID-19. And at the same time, in the next part of my presentation, will be dedicated for how high technology, in particular space technology, can be usable for collection of information, necessary information, and how it can be used for minimization and protection, defense of a negative impact of COVID-19. And in the end, I will provide some conclusion, share my understanding, my vision, how we will be achieve our expectations to minimize and protect of impact of not only COVID-19, any expected in the future negative environment which we are expecting in the future. How to effectively scientists can be engaged into the process and getting the feedback and collection of our efforts all together, making our life as best as possible. So I am. When I was born, it was a country, Soviet Union, former Soviet Union. It was absolutely different system of education. It was from 7 years old. We started to go to school, spending 10 years. After we were able to get high education, spending 5 years for master degree, and 2 years I spent as a trainee. One of the famous research institute of National Academy of Science. It was a physical technical institute, and after 2 years training, I have spent 3 years my PhD and completed my research activities, and was staying there 8 years additionally. Was involved mainly for study sensitive elements for space implementation, particularly for satellite system. And I engaged into international system. I was working for United Nations. Today, I am a co-chairman of International Astronautical Federation Congress. Taking this advantage, I would like to invite all of my colleagues to participate in 2023 in the Congress, which will Baku, capital of my country, will host this very famous Congress, and it will be a great pleasure and appreciated of your coming to Baku to join to this very famous and important event for the world. Currently, I am working for ER-Link, Education Industrial Link Research and Development Center, Kazan University, one of the very famous private university in Azerbaijan, conducting some research activities, application of fundamental science outcomes for industry, mainly main aim and of this activities. Next slide, please. From the January 28, Azerbaijan decided, government decided to start with some actions, necessary actions, being able to minimize expect negative aspects of Corona-19. It was the first step was done for enforcement works in the border lines, but it was open border. Borders were open, but was done some of necessary actions to manage all the system for checking control of all the borders lines of the country, and it has been established a special control system for control of crossing borders of the country. It's airplane, roads, and any other infrastructure were taken under control. And unfortunately, I cannot see the presentation. I will find my version. So, and definitely a flood and other suspected for virus infection was also considering for many things. One of the very important issue was development of emergency lines for information of what is going on, because without information, it will be very difficult to manage, making control of the overall process. Of course, it was absolutely new circumstances and new condition, never happened in the world. And Azerbaijan is a young country, restored its independence in 1992. It is enough short time to be able to cover all or effectively manage all the system. Next slide, please. From this point of view, it was necessary to collect all the information, how to use other versions, other aspects, making limitation of negative impacts of coronavirus. From this point, the government of Azerbaijan has invited representatives for health organization and was given $5 million American dollars for establishment of necessary infrastructure and instruction of what needed to be done, what actions needed implemented for based environment application. But time to time, the next the second action, second communication was established with World Health Organization, and 5.5 million American was additionally given to a health organization for supporting other countries, mainly for African countries, and it was a donation of Azerbaijan government engagement into such a negative process, and was enough impact of financial impact of Azerbaijan for this issue. Next slide, please. So today, current stage, we have around 2,000 confirmed cases and around 1.4 thousand people and 35 deaths. A population of Azerbaijan 10 million. From these figures, we can see situation in Azerbaijan is not so bad. And main issue is to be able to control all the cases, all the situation in Azerbaijan, which is very important. And in the meantime, we are living in a low-time life. All people are sitting at home, just some of infrastructure for giving the life for the country. They are operating, they are functioning. There is no any ceremonies, there is no any malls and shops do not working, operating right now till today. I will additional give information what happened today. Special circumstance was given for people who has more than starting from 65. Those people didn't go outside. For them, it was organized special services for providing of such of people for food and any other needs. If somebody needs to go to a doctor, it was organized and visit the doctor and for established for sit time. If there is no enough to stay during the visit to the doctor should write some additional time, mentioning the extended time to stay doctor, and in order to able to show, to have evidence to show policies which patrolled at that time on the street, covering the whole country. Thanks to such of limitations, I think we have such of less numbers of negative consequences of corona-19. So we had two stages of softening the quarantine situation. It happened the first in 1st of May. It was covered. People can go out within 2 hours, for 3 hours, and some of small shopping were open for providing of necessary services for people. So next slide, please. So it was divided into several stages of column. Depends of the density of the negative consequences. Baku, Sumgayit, Ganje, and Lankaran, and Akşener Peninsula areas. It's a district of the country. Except those places, other places, we have white color density of negative consequences. These regions were open for easily for communication, but it has been established special instruction for epidemiology condition, for instance, 2 meters distance, to use mask, and integration of people was absolutely impossible. It was controlled by policies, which the by policies in the country. So again, it has established special SMS system for getting of official permit go outside. It was everybody who need to go to outside except from 65 age old should send the message, SMS message, special number, get the permit, go outside and to satisfy current needs. But we are very happy today. SMS message has cancelled. Everybody can go outside, but there are special instructions for community, for people, limitation of collecting altogether, distance limitation. There again, any ceremony cannot be provided in wedding process and in other where environment makes possible to a huge number of people. It is again limited. Nobody can do this, and it's very, very strong control by the government. So next slide. I think all of the actions were very useful for limitation of impact of the coronavirus. The next stage is of my presentation is how to use high technology, particular space technology, for this case. So, listening of my previous presenters, my previous colleagues, I understood for successful action and fighting against the corona-19, we need appropriate information, appropriate data. which is very important for decision-making stage. So today, satellite technology advances are using in wide areas in our life. It's a satellite communication, navigation system, Earth observation, telecommunication system, delivering healthcare from distance, which is very common right now, using the satellite environment, advances technology, conduct very complicated healthcare issues. And definitely, it's could be very useful space technology application for coronavirus 19 against fighting of coronavirus. Next slide, please. So, next slide, please. It is one of the opportunity to minimize our face-to-face communication. From distance, we can provide all necessary information, provide very good environment sharing of the data. Definitely, we can use satellite information. For instance, observation satellite. What is happening in our streets? What is happening in the spatial areas of density of people, or for instance, where we have bad situation of coronavirus, or somewhere we best to treat. How we can divide and we select of the appropriate borders for decision makers. All that kind of information can be provided by using satellite technology, and provide this information to appropriate staff who could be use it for future activities. At the same time, huge of information we are getting different sources. What information is necessary? What information is useful in current state? Definitely, we can select artificial intelligence, which is one of the best instruments in selection and dividing of space information, which found out very best place itself in space technology, which could be very useful in COVID-19 application as well. Next the slide, please. So, for instance, China has established a spatial platform for these spatial software application as well, and satellite image for fighting against of corona-19. Application of space technology for getting necessary information, and depends on the task needed to be implemented, needed to be explored. Different types of satellite images can be used for solution of expected challenges for effective, efficiently fighting against coronavirus. Next slide, please. Can you make visible my presentation? Of course, as some another advantage of satellite navigation, we can monitor capability of medical capability, number of hospitals, medical personnel, at the same time, vehicles and facilities. Everything can be used navigation, satellite navigation system can be monitored and used for effective management of the process. Definitely, school lessons today in Azerbaijan, around the world, it's impossible to stop education process, learning process. Satellite system, navigation satellite system, online system have been established for such a kind of our education process. Even our today meeting using online system, we are able to share our views, our understanding. Challenges staying in front of us needed to be solved for minimizing the negative consequences of the virus. At the same time, one of the big problems, for instance, in our country, when established limitation for age from 65, a very big number of people were sitting at home. Some of them were alone. It's very psychologically very difficult to protect it. And in this case, WhatsApp communication, using different types of technology through satellite communication, it was established some alive communication for people, minimizing psychological impact, negative impact for people. Next slide, please. So mainly, I have mentioned the positive impact of space technology, making our life as best as possible. Next slide, please. Next slide, please. So one of the biggest contributions of space technology is the method of remote sensing. It's a very good instrument in space technology for collection of information. Because, for instance, if we have some contribution of negative aspect, we have to control what's happening in our environment. For instance, in case of any natural disaster or the flood disaster, we need to collect some geographical information, making a map, and usually we have to see what happens around us, which is very important for the management process, and getting right information, appropriate information, and fixed information, excellent situation for management, for making a right decision. Next slide, please. And we have to mention that information based on the application of satellite technology, creating of your information system is not only limited as information. This information has a behavior of timing and coordinate system. We know we can answer of question where and time. What happens. We can capture huge of things. It's like book. Each page of the book has appropriate information. Just changing of the page in the book, you can find very useful information and to use in your future activities, in your management processes, in decision making. Next slide, please. So, for instance, we are expecting to enhance our capability for construction of new hospitals, which happen in my country, I think in future countries in Europe as well. It has been reconstructed existing facility as well. But what hospitality, a selection of areas, at the same time, integration of the system into the existing infrastructure, how effectively it can be used. In this case, a geographic information system can be very usable in selection of area, in possibilities, very good possibilities for integration of infrastructure, existing infrastructure, for effective working for healthcare, which is with very fast decision making, to speed of all existing opportunities for in construction stage, in design process. In this case, also GIS information satellite technology application can be successfully used for solving of problems. Next slide. So artificial intelligence, I have mentioned it in my previous slides, of huge information comes to spatial storage, but we have to select right information, which we need in this time. This case, artificial intelligence comes very, very true. Definitely, space image, which comes from satellite, it has very huge volume number of information. We need initially to select what kind of information we need, what kind of information can be used in current stage solution of the problem. It is very necessary in the beginning stage provide some primary selection of information, where artificial intelligence can be successfully used for selection of appropriate information. In this case, in satellite technology, found out very good place, spatial developed artificial intelligence driven satellite for GIS, which is very, very effective in our problems, which internally inside of this problem. Next slide, please. So, coming to the end of my presentation, I would like to mention my conclusion. Them is a global issue. If it is a global issue, we need global issue demands global approach. We have to be ready to solve our globally to solve our problems. From this point of view, integration of concept very, very important in this case. And definitely we have to integrate our facilities, our technology, and any other opportunities. Being able to collect all together, minimize sequences which happens around us. Definitely integration of capacity building, knowledge, and experience of scientists, very, very important. Data share in this case, very important. Maybe I have some information. Even our today, even which established by STEP opens very good opportunity to share our vision, our understanding, our knowledge and experience. Coming to the final, it is my understanding, vision I would like to share with my colleagues and to give some suggestion. STEP is a very good platform for activities in science and technology. It's the main aspect, main target. And I would like once again to thank for such a very organized integration of efforts of the people around the world, the scientists, and especially coming together and discussion over today live, which is very complicated and nobody knows what will happen in the future after 1 month, end of this year. So I am suggesting to organize STEP global emergency group just for emergency issues. STEP covers over all the scientific and technological activities, but internally inside of the STEP, we can nominate some group or team, doesn't matter, within the framework of STEP global emergency group for duly response of any global change which happens today, what will happen tomorrow, after tomorrow. It is my suggestion for any feedback, any positive or negative feedback, highly appreciated. I would like to thank once again for inviting to participate in such very important event. And I try to do my best and to share my understanding in this area. Thank you very much, Mr. Chair. Thank you very much, everyone.
Thank you, Dr. Rostam, for your detailed presentation. Can you hear me? I have a question from audience to ask you.
Of course, I shall be happy.
Okay, Professor Farid Alam has asked a question that do you think testing first, if no good, then mobile tracking will help. So what do you think? Mobile tracking is more important or testing and testing?
I think it's very difficult to divide separate actions. It's a common activities for solving common problem of COVID-19. Testing and providing mobile communication, both of them are very important in such a complicated our life. I think it's very difficult to divide and to select which one is important and another one is low important.
Yes, I agree that you have to use both technology and both practices available. Okay, thank you very much, Dr. Rostam from Azerbaijan. Thank you very much. We move on to our next speaker, Dr. Hossein Qanaati from Iran, who is a professor at Tehran University of Medical Technology and also the head of a think tank room for Corona crisis in Tehran. The title of presentation by Dr. Qanaati is The Experience of Iranian Confrontation with COVID-19 Crisis. Thank you very much, Dr. Qanaati.
Good afternoon, Professor, colleagues, and also colleagues in the remote area. May I have my slide, please? Okay.
We need a slide of Professor Qanaati.
Okay, thank you. I'm going to briefly explain about the COVID-19 crisis, what's happening in Iran, analytic evaluation. Next one, please. Next. اسلاید بعد بی زحمت.
هنوز اسلاید رو نیاوردن دکتر، باید صبر کنیم. خوبین انشالله.
Okay.
We have to wait.
Okay. First of all, I must say thanks to Mustafa Science and Technology Foundation to invite me for this great symposium. And I think COVID-19 is a surprising event that surprised everybody in the world, governments, everybody. And okay, next one, please.
Yes.
It's very difficult to see the slides. Okay, this is my colleagues in the think tank room. Next one, please. جای من خوبه اینجا وایسادم؟ اینجا خب خیلی رو به سمت دوربینه. پس من دارم اون و پلو طرف آقای دکتر وایسم. آها گاهی وقتا خب بعد همه رو ببین. Okay, next one please. As you know, COVID-19 symptoms also different from the other diseases, similar to the flu, but for example, there is no nasal congestion, and the delay of the symptoms make it more contagious and make more contagious in the people. The next one, please. بچه سریعتر برین، خیلی اسلاید دارم لطفاً. And about the test and CT scan, everything that we use, we understood that CT scan more better, 95% sensitivity in compared to the test that maximally in Iran is about 56, 57% sensitivity. Next one, please. The main point of the crisis management in Iran was, according to the Quran, that say, and who were saving one, it's as if he had saved mankind entirely. Man ahyaha fakannama ahya an-nas jami'an. In the government manager, I saw that Mrs. Merkel have the same manner. Next one, please. It was very important to us, for us to save the life, and we haven't no patient to know that never have access to the ICU. All of the patients have been covered by ICU, hopefully, and we never neglect anyone. As you know, the pathogenesis of the virus is different from the other viruses, and nobody knows definitely and cannot predict what happened economically, politically, environmentally, and psychologically. And maybe one of the all of the items that I will tell you modified in the future. Next one, please. لطفاً سریع باشین چون خیلی اسلاید داریم. This is a pattern that some epidemiologists considered it for the flu event. Flu have a period of determined period of time of activity, but is this prediction curve correct for the COVID-19? I don't know. Next one. And about the lockdown, is the lockdown reduce the amount of the patient totally? Nobody knows. Of course, lockdown make opportunity for us that less patient have in the period of the time, but totally the number of the patient maybe not change. Next one, please. And how long virus will be alive on the surface? Is some people have some estimation, for example, on the still for 4 to 7 days. Next one. About the mask, definitely mask health prevention. As you see in the bottom of the left side slide, you see, next previous one please, قبلی رو بیارین. That if the patient use mask and also the healthy people use mask, the transmission probability reach to 1.5%. Without mask, the transmission reach to above 70%. Next one. The critical and important factors in the COVID crisis control was previous experience. For example, China and South Korea have experience of the SARS, therefore they could able to control the crisis better, and on-time reaction and also intelligent physical distance as much as possible make the controls more successful. Next one. Quarantine have been innovated by the Avicenna, Iranian scientists 1,000 years ago for control of the one epidemic on that time. Next one. This slide showed significance of the quarantine. If you look at this part, you see that if there is no control here, I mentioned here, if there is no control, after 30 days we have 3.6 people infected, and if we have 75% control of exposure, I mean 75% control of the quarantine, one person only can infect 2.5 person, 200% less, 200-fold less. بعدی بی زحمت. The Diamond Prince cruise give us some clue and some key to understand more better about the COVID-19. In this ship, about 4,000 passengers present on that time, and you see only 700 of them have been involved. They have very close contact, and we can use it as a model to understand how many of the people, how percent of the society will be involved by this virus. Next one. The epidemiologic evaluation in Iran have been estimated in Ministry of Health in the best condition 2,000 deaths, in the intermediate condition 9,000 deaths, and in the worst condition 14,000 cases. Next one. And some estimation by other epidemiologists in Iran was to 54,000 deaths, but hopefully not happen. Next one, please. Next. Next. Oh, slide قبلی رو گذاشتین. This is the estimation that will be done in the 17th of the May 2020. As you see here, total cases in Iran now is 120,000 cases, and total deaths is around 7,000. Next one, please. And this shows some information about the involved people and some information about the deaf people. As you see here, the male are more involved in compared to female, and also we have more deaths in the patient with comorbid over 60 years old. Next one. This is our suggestion for the future. As you see on that slide, we see here that the amount of the deaths is going to down, but now when you look at this new involvement, see that after this peak from 2 weeks ago, again we are going to rise. Is it the second wave? We don't know. But our suggestion is that at the 30 days later, we have less patient, and we hope that this wave of the disease will be disappear. Next one, please. Next one. I said that. بعدی ببخشید این اسلاید قبلی منو گذاشتی متاسفانه. بعدی تون برین از اینا رو باید حذف می‌کردید. بعدی خب برید به زحمت. Next one. بله. اوکی بعدی. خب. There was some management problem during the beginning of the crisis. There was no picture of the problem for different countries, including Iran. And we have a lot of crisis organization, Iran Red Crescent, Passive Defense Organization, Ministry of Health, who must manage the crisis. At the beginning, the Minister of Health was manager of the crisis in the whole country. And hopefully, very fast we change to the president, because it's very big problem, and the Minister of Health is not enough. And very bad. And sanction have very significant influence on our ability to confront this problem. One of the big mistakes in my country was that we sent outpatient people to the referral hospital. Hopefully, we understand it very soon and correct it. One of them was a delay in quarantine, and one of them was herd immunity idea that have been set by the Boris Johnson, Prime Minister of the United Kingdom, as a strategy in the beginning, and see what's happened in England by this strategy. Hopefully, this strategy never used in Iran. And next one. One of the problem is non-COVID patient. Today, I reviewed the literature and saw that NHS in England said that the non-COVID patient is a big problem now. A lot of patient needs care, heart problem, stroke problem, cancer patient, and we assign a majority of treatment facility to the corona, and the number of the patients referred to the hospital have been decreased. Now, in my hospital, Imam Khomeini Hospital, we have less patient in compared to the routine times. Next one. And government made a lot of extra bed ready in parkings, in the sport complex, but hopefully none of them have been used, and just was at the reserve for the unpredictable part of the crisis. Next one. The landmark of the crisis was tolerance and spirituality of the Iranian people. I was involved for medical services during the invasion of Saddam Hussein in front war area, and I saw unbelievable brave man on that time. I haven't no idea about the young generation. I saw that young generation nurses and doctors in Iran, Islamic Republic of Iran, came and give the best services and unbelievable services. As you know, the WHO considered Iran as one of the most successful country for management of the COVID-19. Next one, please. You see one of our exhausting colleagues in the hospital that other colleagues help her. Next one. And we give 120 deaths to now from the health service personnel. Next one, please. And really religious ceremonies with protection is continue, and I think it's very important. Next slide, please. And real love story haven't happened in Iran also. You look at this picture. Next one, please. Next. And uprising of nation against corona to give people foods, everything, money, and they cover each other. They omit the rent